Good morning. I'm happy I have the chance to talk with you all today about some lessons that I've learned from clinical practice, specifically with regards to immunizations and the role that healthcare providers have in recommending and promoting immunizations within their practices. Research studies have repeatedly shown that the source of information that parents most trust when it comes to vaccine information is their child's doctor. In making a recommendation, a strong recommendation to parents, it's important to recognize that it's not just what you're saying, but it's the fact that you as a healthcare provider are taking time as part of the child's healthcare visit to spend time talking about vaccinations, so that both what you're saying and the time that you're spending on it tell parents that this is a topic that is very important for their child. Part of making a strong recommendation as a healthcare provider involves not just what you have to say to the parent, but it also involves what other office staff are saying to the parent and their child during the course of their entire clinic visit. It's important to establish a culture within one's healthcare facility that promotes vaccines from the moment parents and their children arrive to the office to the point in which they leave. As a healthcare provider, you may be the person to answer many of the detailed scientific questions that parents have to ask. But if questions come up, for example, during the course of taking vital signs of the child, if the parent has a question, they ask a medical assistant. It's important that medical assistants, nurses, physician assistants, nursing assistants, all clinic staff have a responsibility to help promote vaccines. It's important to set a culture within your healthcare facility that promotes vaccines from the moment parents arrive with their children to the moment that they leave your office. There are several components to making a strong vaccine recommendation as a healthcare provider. First, and probably most important, it's just taking time to listen to parents' concerns, encouraging questions that they may have. Don't be judgmental when offering responses, and be forthright about the benefits of vaccines, and if there are known risks, be upfront about those as well. One of the challenges that healthcare providers face when trying to make a strong recommendation for vaccination is determining the right balance of science versus stories or anecdotes when making one's recommendation to a parent. Some parents may be most persuaded by scientific facts, evidence from research studies. Personal stories can be a powerful way to express to parents your strong recommendation towards vaccination. As a father of 3 children, all of my children are vaccinated according to the ACIP recommended schedule, and this is something that I discuss openly with my patients. And so it involves the healthcare provider trying to understand what the needs of the parent as well as the child are in terms of answering questions relating to any vaccine concerns that they might have. Another valuable resource when talking to parents about their vaccine concerns or questions is talking to them about examples of outbreaks of vaccine-preventable diseases in the news, things that they may have heard of in the press. Vaccines are one of the biggest public health success stories, and the challenge with that is that the success of vaccines has led to vaccine-preventable diseases like pertussis, measles, mumps, becoming less visible, and as a result, public concern has waned over time. For parents here in Michigan, it may be helpful to remind them or alert them to the fact that our neighbor to the south, Ohio, has been home to the largest measles outbreak this year, and one of the largest measles outbreaks that we have seen in some time. Measles is one of the most infectious diseases in the world and is frequently imported into the U.S. And it's also important to educate parents about some of the complications and risks of these vaccine-preventable diseases given that many of them may have never seen them. When it comes to measles, up to 20% of children are hospitalized. Complications include pneumonia, ear infections, and encephalitis, or swelling of the lining of the brain. These are things that are important to educate parents about so that they can understand what are the risks and benefits of making vaccine decisions. Another vaccine preventable disease that has been in the news quite a bit lately is pertussis, or whooping cough. In 2012, we know that there were nearly 50,000 cases of pertussis reported in the U.S., with many more going undiagnosed, because pertussis can often be a challenging disease to diagnose. This was the most number of cases reported in the U.S. since 1955. There have been large outbreaks in states such as California and Washington, and we know that clusters of intentionally unvaccinated or under-vaccinated people can lead to pertussis outbreaks like these. Pertussis can be a severe illness, especially among infants, and this is something that's very important to remind parents of. About half of infants less than 1 year of age who get pertussis are hospitalized. And pertussis can lead to pneumonia, brain damage, seizures, and even death. In talking to parents about vaccinations, it's also important to refer them to trusted sources of information. Nowadays, many parents rely on the internet as their primary source of information about immunizations. They may not rely on trusted internet resources such as the Michigan Department of Community Health website on immunizations, or the Centers for Disease Control and Prevention's website on immunizations. And so it's important to have a dialogue with parents about their sources of information and make recommendations about what are to be trusted sources of information online. Research studies have shown that parents who rely solely on the internet as their primary source of information about vaccines often have lower perceptions of vaccine safety, vaccine effectiveness, as well as disease susceptibility. Research findings such as these highlight the importance of healthcare providers taking time to talk with parents about trusted sources of information, both online as well as elsewhere. Research findings such as these highlight the importance of helping to guide parents towards trusted sources of information. Ultimately, as healthcare providers, we need to encourage a continuing dialogue with parents about vaccines and encourage them to bring questions or concerns that they may have to subsequent visits. Ultimately, as healthcare providers, we should encourage a continuing dialogue between us and parents with regards to vaccines. Just because they may choose not to vaccinate their child at one visit doesn't mean that vaccines shouldn't be brought up at the next visit. In fact, never miss an opportunity to discuss vaccines with parents. They should be brought up at every single clinical encounter. Ultimately, making a strong vaccine recommendation to parents involves 1, taking time to discuss vaccines with parents at every single visit. 2, leading them to sources of information that are trustworthy. And finally, and probably most importantly, it's important to create a culture within your healthcare facility that encourages parents to bring questions and concerns with them and express those questions and concerns whenever they arise.